next section of the program,
Na próxima sessão do
and that
programa.
has to do with the grand challenges. So we've got 4 people who will be making contributions to this piece. May I invite may I invite them to come here to the panel, perhaps. Gary Darmstadt from the Bill and Melinda Gates Foundation, Claude Pirmez from the Instituto Oswaldo Cruz, Dominique McMahon from Grand Challenges Canada. There you are. Eduardo Marino from the Fundação Maria Cecilia Vidigal. So, friends, the floor is yours. I mean, this session is to give us a sense of what the grand challenges in Brazil are all about. And we have about half an hour, so I'll leave the proceedings to you and to our co-chairs.
Okay, thank you very much, Zolfia. I'll kick it off here and give a brief overview of the grand challenges. Maybe if we can, here we got my slides, okay. Figure out how to advance this. Okay. So the grand challenges were initially conceived back in 2003, and they actually were patterned after a call for solutions in mathematics that came at the turn of the 20th century. And it's since evolved from an initial call around global health in 2003 to a whole diverse family of initiatives, a whole variety of partners, which I'll explain a little bit more. What grand challenges really are meant to do is to engage people's imagination and to engage them around really big challenges in global health. We're calling for people from all over the world to come together to form a community and together to address these challenges. So far, we've had over 1,000 grants, well over 1,000 grants in 50 countries funded so far. And these initiatives are really meant to take risks. You know, these are big challenges. These are things that are not going to be solved easily, things that not any one partner can solve, and the things that the investments are going to be risky. And so it was one of the things that as the Gates Foundation, we felt that we could really lean into that as something that we're fundamentally about, is taking risk and accepting failure, but learning from failure as we go along. We're really aiming to bring new innovation to these spaces through a whole variety of partners, including the private sector. And it's really meant not just to advance science, but to really achieve impact. And so one of the key themes is that these grants are all managed as a portfolio towards the achievement of global impact. Some of the principles are that we try to very carefully define the challenge that we're trying to solve. We found that is critical to get good ideas. Again, we're seeking ideas from all over the world. I think this is the global health kind of equivalent of The Voice. I don't know if any of you watch that show, but people are chosen just strictly on the quality of their voice. On these grand challenges, we don't know who you are. We don't know where you're from. All we see is your idea. And so it's really meant to focus in on what is the idea and the quality of that idea that you're bringing forward. But we're also looking at what is the feasibility around this idea actually making a difference and actually being able to go to scale, from moving from the laboratory, for example, actually into the field and really affecting people's lives. We actively collaborate and we actively seek to build a community of practice around an idea so that people come together and share what they're learning, share where they're struggling, develop new partnerships together, and together work on solving this grand challenge. And one of the requirements to enter into this is that you agree that you will make your information widely available, that any inventions that you come up with are part of the global good. And so that there are certain global access commitments that people make as part of this. This just gives you some sense of the scope of where Grant Challenges has grown from that first call in 2003. You see along your right a series of Grand Challenges in global health. These are larger grants that are around specific calls in global health. As you can see, many of them have been in family health, in TB, but they become really quite diverse with other countries. Brazil has really been at the forefront. along with India and most recently now South Africa, coming in and forming their own challenge and giving their own flavor to the Grand Challenges. We've gone on to create Grand Challenges Explorations, which are smaller grants, which are managed very lightly, and these grants are really about giving people the freedom to explore their ideas, to really try new things, and then as an idea is showing promise, that we come in with further funding to support that idea going forward. And then on the left are a number of partners who have come in, again, giving their own flavor to these challenges, particularly Grand Challenges Canada, which you'll hear more about. USAID has really embraced this approach. Several countries, as I mentioned, have, and there are other partners who are part of several of these initiatives as well. So it really has become a global movement around solving big challenges. When to use a Grand Challenge approach? It's really not for everything, but we found that there are some situations in which it's really advantageous to go in this direction. One of the things that we've learned is we have to be able to clearly spell out what is the challenge that we're trying to solve. And so it's really amenable to putting it almost in a question form or a hypothesis of what it is that you're trying to address or trying to solve. It's where you need new ideas. You need new people coming to the table, that you want to kind of turn things upside down a bit and get outside of the usual way of working and bring new ideas and partners to the table. Again, where no one partner can do it together and where we need to collaborate. We found that it's really helpful where you're looking for a whole wide variety of ideas. One of the great things that I have found personally being involved in the Grand Challenges is just seeing the incredible breadth of ideas that come in around these ideas, and it really expands your mind around what a possible solution might look like. And then build a portfolio of approaches to try to address that problem. We're not looking for one solution. We're looking for a variety of solutions that need to come together in order to effectively address this. And then again, we look to build a community of people who will come together and openly share what they're learning, both their failures and their successes, and use it as an opportunity to develop new collaborations going forward. Some of the big lessons that we've learned is this is a powerful tool. It's a powerful way to reach out to the world and to engage people who might not otherwise think about these challenges, but think, wow, I might have a chance at this. Let me give it a shot. And who come together around this idea. We found it to be very motivating, and we're particularly trying to challenge young investigators. Again, it's a blind competition. You have the same opportunity as your mentor, really, to put your idea on the table. There's no seniority involved. We found, again, that we need to be really clear on defining the problem. And one of the things that we've evolved with Grand Challenges too is having several rounds or several calls against that particular challenge. Because we've often found the first time that we frame the challenge, we don't get it quite right. And as we get ideas coming in and as we learn from that first review process, we refine the challenge, the question, and use that to improve what we're doing. Again, it's a way of capturing a new cohort of people around a challenge, and that this is really, it's a great learning opportunity. Just very briefly, we, as part of the 10th anniversary of Grand Challenges, launched a whole series of new challenges. You'll be hearing more about them from other speakers here in just a moment. These are some of the ones that we announced in early October. I just want to say a brief word about this one because I don't think anyone else here will probably mention this one. This is really calling for putting women and girls at the center of development. Not that it's only just about women and girls, but they are marginalized throughout societies in the world. And in order to advance global health solutions, we need to engage women and girls and address gender inequalities in order to really maximize our impact. And so we're looking for strategies to effectively reach and empower the most vulnerable women and girls throughout the world to improve their health, their development, their economic outcomes, as well as address gender equality. So we'll stop there and we'll move on to now Claude. I believe you'll talk about the Grand Challenges Brazil. And again, Grand Challenges Brazil has been a fantastic partner, first around preterm birth, now around all children thriving. in bringing together Brazilian investigators to address challenges in a way that's really unique for your ecosystem. Thank you very much.
Good morning, everyone. It's a great pleasure to be here and show and talk to you about the Brazilian grand challenges. The partnership between the Bill Melinda Gates and the Minister of Health started in the year of 2010, and it was built on common interests, considering the Brazil health needs and the national policy agenda identified by the Minister of Health. And this was started with four different approaches, as Gary already pointed out. So the first one was vaccine development and manufacturing. Second, family health research. Third, discovery research, and this is done in partnership with the FAPs, the state research foundations. And the fourth one is joint global initiatives, and there's already 2 projects involved in this initiative, one in TB diagnosis, and the other one in a field testing of dengue vector control. And the Grand Challenge Brazil was launched in 2012 during the GC meeting in Rio. And it focused on reducing the burden of preterm birth, specifically seeking innovative strategies for prevention and management of preterm labor. At that time, a total of 156 projects were submitted, and 12 were selected, 2 as full grants and 10 as seed grants. And the call involved a total amount of 8 million reais, and it's co-funded by the CNPq and the DSIT at the Ministry of Health. And these 12 projects at 12 different institutions in Brazil they are all addressing the problem of preterm birth, ranging from fundamental research, investigating then the causes of preterm birth, to development of new solutions, including clinical trials, involving either the treatment of preterm birth infants and or the management of maternal health. And a third line of these studies includes the analysis of social and environmental factors. So we hope this project started actually this year. So we are learning in the process together with the CNPq, with all the bureaucracy we have in Brazil. But we are learning this, so we hope the second call is going to be easier. We really hope that these innovative strategies will contribute for prevention and management of preterm labor. And my role is to put them together, articulate all these projects, all these researchers together, and so aiming in the same target, which is the reduction of preterm birth. So we know that there's very important additional challenges that Brazil has to face beyond these early phases of life, and that is how to shape a long-term health after birth. Mainly when we think about Brazil has this continental size with a population now over 200 million, we must think about innovation in a sustainable way to enable a broad, affordable and universal access. The complexity of these challenges indicates that there's a strong need to work in an integrated and systemic approach. So moving forward, the second grand challenge of Brazil is all children thriving. This goes together with India and South Africa. And so the call is open. It includes the second phase of reducing the burden of preterm birth, but mainly it expands the research to promote health throughout the entire life cycle. So this second call it has 3 different avenues. I'm finishing. three different avenues. The first one concerns diet and nutrition, so during pregnancy, during the first 6 months of life, so focusing breastfeeding, and finally during the period after, till the age of 5. The second avenue refers to maternal, newborn, and child health, and this is very broad, so immunization, health interventions, postnatal growth, management of childhood illnesses, and early child stimulation. And finally, the third one concerns the social and environmental factors, particularly what refers to water, sanitation, nurturing, violence, and child abuse. So all the researchers here, please do submit projects. You just have to access the CNPq platform. It's not difficult. Just put your ideas in it. There's a total fund now of 10 million, or again, co-funded with the Ministry of Health, the SICH, and the CNPq. And you should address innovative studies in an integrated and systemic way so that you provide answers that will strengthen the healthcare system. And it's going to be interesting to see the experience of 3 different countries at the end, India, South Africa, and Brazil, and all working in the same objective, and what the solutions the researchers can find. Thank you.
Good morning. So we just have a few minutes today for me to introduce you to Grand Challenges Canada and to the Saving Brains Grand Challenge. My name is Dominique McMahon. I'm the Program Officer for Saving Brains at GCC. So please do feel free to come up and say hello if you're looking for more information afterwards. Okay, great. So Grand Challenges Canada is interested in bold ideas with big impact, and we're entirely funded by the federal government of Canada. And we're looking for funding for innovators who are in developing countries or Canadian innovators who are implementing in developing countries. And we're looking for ideas that really encourage this idea of integrated innovation, that is, that employ both social innovation, financial innovation, and science and technological innovation. And we believe that that can help catalyze ideas that will have impact at scale and that can be sustainable. And we have a big focus on results, and for us that means saving and improving lives. We have 4 main programs at Grand Challenges Canada. The first is our STARS program, where we put about half of our financing, and that's really around innovator-defined challenges. And the other 3 are targeted challenges that are moving against a specific area in global health. We're part of the Partnership on Saving Lives at Birth, and we've initiated Grand Challenges in Saving Brains and Global Mental Health. I think everybody in the room is familiar with the problem that's affecting a staggering about 1/3 of the world's children who are not reaching their full developmental potential. And we really see the challenge as developing sustainable products, services, implementation models, delivery models that can really go against this and protect, promote, and nurture early brain development and child development in the first 1,000 days, but going beyond that, where there's good reason, that can have a lasting impact at scale on the formation of human capital, and that can be applicable in low resource settings. And similar to the forum, we take an approach that the child is really at the center of this, and that children living in poverty often face multiple adversities. And so we have to combine approaches that promote health and nutrition, that protect against maltreatment and violence, and that provide an enriching and nurturing environment. So far, we've put about $33.7 million into this grand challenge to accelerate progress against the problem, and that includes funding a platform that helps to accelerate progress. Our first phase of funding was our focus phase, and what we were doing there was really trying to establish the persistence, the persistent impact of interventions that occur early in life. And that was around 11 grants and following up those children 4 to 18 years later to see what that impact has been on human capital formation and on their development. The funding that we're doing right now is focus phase, and it's really around the implementation of new novel ideas, both at a proof of concept level and how we can transition those to scale. So I think it'll be really interesting to see in this meeting how those ideas around scale are come forward. So we have now 2 funded rounds in that and a 3rd in peer review. And we really fund not only academics, but entrepreneurial ideas, all kinds of different types of organizations that we think can make this happen. But we know that we can't do this alone, and that this is going to require a partnership where a lot of different organizations can bring together their skill sets and their funding, of course, to help bear against this grand challenge. And so we're going to need global partners, regional partners that really understand the context in a specific region and can help move against that challenge in their context, implementation partners who can really help move this to scale, and corporate partners who can support scaling specific innovations that match with their strategies. And so in October, we were thrilled to announce the Saving Brains Partnership, which includes Grand Challenges Canada, Bill and Melinda Gates Foundation, Norleen Foundation, Bernard Van Leer, World Vision, Aga Khan Foundation Canada, and of course the Maria Cecilia Souto Vidigal Foundation here in Brazil. This foundation, the Fundação here, is actually our longest standing partner and has been really important at enabling innovators to be supported here in Brazil. And so with that, I want to welcome Eduardo to speak a bit more to that specific aspect. Thank you very much.
So good morning. My name is Eduardo Marino. I'm Research and Evaluation Manager from Maria Cecilia Foundation. As Guilherme mentioned, our focus in ECD is pretty new. We started to operate in early child development in 2008. And I'm gonna tell you a short story on our learning on supporting research and innovation for scale in ECD. First, I will talk about our first hypothesis of creating solutions in scale in ECD. In 2009, we established a partnership with a state research agents that support researchers called FAPESP, and together we created a joint fund to support ECD specifically with the objective of improving services and public policies from the pregnancy to the first 1,000 days of life. To date, we have supported 26 projects, and last year we decided to conduct an external evaluation to learn in which extent these projects are really contributing to public and program in ECD. And what we learned with this evaluation is that although the researchers' studies are very relevant in academic terms, the pipeline to impact a public policy will be long. We are still actually involved in this partnership. We will open next year a next request for proposal, but we start to discuss another ways to support projects. At that time came the possibility of start to work with Grand Challenges Canada. Eduardo Queiroz was part a peer review committee for, I think, the second round of Saving Brains platform. And he came back to Brazil very impressed with the methodology of Grand Challenge Canada. At that time, the Brazilian projects were not eligible to apply to Grand Challenge Canada because the focus was in low and mid-income countries. But for who were at the dinner with Ricardo Paes de Barros, he mentioned how Brazil is increasing in terms of revenue and a lot of indicators, but we still have very poor conditions in some regions in the country. After some talks and negotiations with Grand Challenge Canada, we make an agreement to support Brazilian projects with some support of Grand Challenge Canada. Then we launched last year the first request for proposal. We had selected three Brazilian projects. These projects address big challenges in ECD in Brazil. One of them is related home visiting program that will be implemented at the west part of São Paulo. In this project, they have all the characteristics that Dominique mentioned. They are really, the lab of these projects is the real world. Is the services and the interaction between researchers and the real world. And they are focused on a very well-defined proof of concept and a strong evaluation methodology. And our vision for the future for these projects is not only support city projects, is to create a Brazilian Saving Brains platform. Our plan is involve private funds to support the transition for scale for these projects and really go ahead with this very impact initiative. Thank you.
Thank you for all the panelists in this session. I'm going to now call the next session. Good morning. My name is Eduardo Quiroz. I'm the director of Maria Cecilia Souto Vidigal Foundation. I'm going to speak in Portuguese. We are in Brazil. For people not from Brazil or bom dia a todos.
Good morning, everybody.
Começando de novo.
Starting again.
Eu primeiro queria agradecer a presença de todos vocês e agradecer a todos os parceiros do fórum.
Thank you.
E é com um grande prazer que eu gostaria de chamar uma grande amiga da Fundação e uma pessoa que fez trabalho, eu diria que sensacional, até recentemente na Secretaria de Educação do município do Rio de Janeiro, e é uma especialista em políticas públicas,
public policies in the area of education, and today, for our great honor, she has a strategic position, not only for Brazil, but for the world. She's the global director, the senior director for education at the World Bank Group. So we have a Brazilian woman in this position, and this is cause of great honor for us. She opened up a space in her agenda. She's just been back from Korea. In 3 days she'll be in Ethiopia, but she opened up this space to come to Brazil, especially for this meeting, to be here at this forum. So let me come and welcome to the floor Claude Costin.